Shireen is Manager of Research, Evaluation and Analytics, Addiction and Mental Health, Edmonton Zone, Alberta Health Services, and Adjunct Assistant Professor, Faculty of Social Work with the University of Calgary. Her scholarly interests are in the areas of addiction and mental health, homelessness and housing, healthcare of the older adults and immigrants, impact of culture on health and caregiving, culture and gambling, and elder abuse. I'm sure there's a longer list somewhere. She is an expert in examining adjustment and well-being issues of the aging South Asian population in Canada. So I'd like to invite Shireen to come up.
Okay, thank you, everyone. I know, it was a big laundry list. Oh, sorry. I was looking for the mic and I couldn't find, and I went all the way there. I want to begin by thanking you all for finding time and coming and joining us here today, and of course extending a big thank you for Homeward Trust for giving us the opportunity. The main aim of my presentation is to give you a better understanding of what data exists or is collected in Alberta Health Services with a special focus on addiction and mental health. How is the data used in informing our policies and practices, and how the external agencies and researchers can access the data? So as the saying goes, what gets measured gets managed, and this holds true for Alberta Health Services. Whether it relates to our day-to-day operation or making changes to our long-term strategies. The aim of collecting data is for our organization, is to provide an accurate measure for reporting on our performance for a wide range of decision-making purposes. And this data is collected in dozens of information systems across the province. And then for us, it is then trying to integrate the data to make a meaningful sense out of it and get meaningful information drawn from it. So we at Alberta Health Services, we have access to different level of data, right from the population health level to the patient level information. So this slide shows the level of measurements that we have access to and how each information is used. So if you look at the top level, that's data at the population health. This data is not collected directly by Alberta Health Services, and various agencies such as Health Canada and Stats Canada usually conduct the population health survey surveys. However, we can get access to this data. There are also provincial level surveys such as Satisfaction and Experience Survey conducted by Health Quality Council of Alberta. And the information from these surveys are used for benchmarking, health surveillance, monitoring prevalence of mental disorder and addiction, in planning, implementation, and evaluating programs, and how we can improve the health of all Canadians. The third level data that you the second level data is the system level, and this is collected through our AHS administrative and organizational databases, or created through direct data collection. And select addiction and mental health matrix that are similarly collected across the province are aligned with Alberta Quality Matrix for Health Framework and used for our annual performance reporting to Alberta Health, and also within addiction and mental health and Alberta Health Services. The system level measurement, this is the level where we want to spend, or we spend most of our time, and this includes our analytics, program evaluation, or quality improvement activities, basically looking at or reviewing and evaluating our programs to see what's working and what's not working. And the third level, the last level, which is the patient level data, This is the individual patient level information is collected for patient care purposes, but we know by combining all the patient level information, we'll be able to make better improvements or make improvements to our program level programs and services. So prior to the introduction of eClinician, which is the electronic database in Edmonton Zone, the patient level information was available through chart reviews, the patient client charts. But now with the introduction with EMR, the access to consolidated data has become possible, and it also gives us the ability to pull matrix right from the source. I really apologize for the slide, and I couldn't find a better way to present it, but it gives you a snapshot what data is available, and depending on your question, which are listed there, depending on your level of question, what variables or what data can you retrieve from Alberta Health Services. So we can start with the top, which is the client level information. So your first question is, who are our clients? What's the demographic characteristic? Who are people who are coming and receiving service from us? So there's a list of demographic information, such as their date of birth, gender, their address, and their associated socioeconomic status. This is a proxy variable, and this we receive from a population registry. And if the client is involved with the forensic, if this is a forensic client, then that information is also available, like their legal status and are they certified or not? So that information is also, and this is also the place where you will, if you are interested in our homeless clients, so this is also the place where you get that information, and that you will glean from their postal code, basically, and then you have to go and see further variables to get more information on that. So wait time are monitored regardless of where the patients are in their recovery journey, and we can trace service pathways based on the question again. And we can look at their health conditions or the diagnosis, both current and past, what steps they have to go through in their patient journey. So you can basically trace all the lines that you can see with the, like who their providers are, who were their past providers, who was their primary caregivers, their care team. You can also look at the place where they received the service. Was it at emergency department, in a community, or were they inpatient in their homes? Was the service received at a specialized program? So one area there we really lack is the answering last question, what did they cost? And there are very many gaps in collecting that information. And there are some journal estimate of cost of hospitalization, emergency department, EMS usage, and things like that. And most of the things, but we lack the ability to drill down by service, by providers, and in a specific service area. We also measure some outcome measures. So in case, say for instance, in case of death, we'll be able to get these statistics, and usually it comes from vital statistics. Here is a little bit more in-depth view of what type of administrative data exists. So, and what type of information is included in each administrative data. So the first one we look at is the Alberta claims data. This is the patient billing data. It contains clients' demographic information such as age, gender, location where they receive the service, the physician, all the costs associated with each procedure that was done, is recorded, is reported there. The health conditions are also can be found. However, no primary diagnosis is identified in that data, and the information is coded using ICD-9, whereas in the other data system, it's ICD-10 coding is used. For our inpatient discharge, this data source include information for acute care and psychiatric facilities, and it collects similar information as Alberta claims data regarding the demographic, gender, who the physicians were, and the health condition here is reported as which was the most responsive cause. So, or anything that was most resource intensive is recorded here, and you will also get the length of a stay if they had the ALC days. For whatever reason now, if they are not being discharged, they are ready to be discharged, but they are not. And also the expected length of a stay is recorded here. For our ambulatory care is the third data set that we have. This again collects similar information as the above two, and but it's based on our services that are provided through emergency department and outpatient clinic. And here you can get information like the number and length of number of visits and the length of visit in the emergency department. Our death is collected in case of death. It's collected in our data source that comes through vital statistics. It's not an internal AHS data source, and moving to the population registry data. This is again an external data source, but we have to make a special requests to get the data. There are also standalone databases, and prior to our electronic medical record in Edmonton zone, it is now consolidated. Both addiction and mental health community services information is recorded in this, in our e-clinician, but it's still true for our other zones where they can have standalone databases, and some of the programs are even collecting information using pen and paper. So we are also collecting data on our outcomes. So HONOS would be one example. This is Health of the Nation Outcome Scale, and this is to look at the treatment outcome of our clients. And this information is collected across Alberta for all our addiction and mental health patients. Next is our patient satisfaction survey. This is also looking at the client experience. And this information for all our addiction and mental health clients are collected across the zone. And again, we do have some information on our funding and costing data, but it's limited. So use of data, it could have been a presentation on its own, but I have tried to summarize and give some very broad examples here. So this is our system level report. Is generated annually, and if you look at the top level is the population level data, and our system level report includes the 6 dimensions that you see, and it's mapped around our health quality matrix, and we have picked dimensions or indicators that are collected similarly across the zone. Here is the example. It's available on our AHS website, and it can also, the summary version can be Googled easily. And I have also brought a copy. You can see this. It's for you to look at if you want. Here is our example of HONOS, and these are the analysis reports are done annually, and all our programs in Edmonton zone get the report, and for our The data is also reported on the provincial, zonal, and program level. And this is just to show you the form that it's collected. Here is, again, the 3 levels of reports are created for our satisfaction surveys. And all our individual programs get their program level report. This is a form just showing what we collect on different dimensions. This is another example of how the data is reported and the programs use this information. This is a quick fact sheet that we in Edmonton creates for our program. It's just an example to show where, for individual services, where's the population coming, who are using our services based on their treatment, gender, and how does the basic demographic of, for each program. Now we are trying to move from our the quick fact sheets that are manually created to the electronic database, and here's some example that we have created for our inpatient services. And if you click on those, each database, this is how it will, you have the ability to drill it down right from the overall picture to the very program level, unit level information, and based on fiscal year and things like that. Here's another example how our program managers can use the data to look where the program or how the service is being used in the community. Here is a spectrum of housing projects. We have been involved in our housing for a number of years in different kind of projects, and here are some key domains that we have used in the past to evaluate our projects. Here is another example. This is, we did social return on investment and for our one of our program, and doing the longitudinal evaluation of the program, and good news is we were able to get the funding operationalized for this program. This is for one of our housing programs based on that. This is another way that we track our program and the performance of our programs and take it back to our managers so that they can provide better care to their clients. And here is my information of how you can get access to the data. You can contact me if you have, especially if you have questions around addiction and mental health or Edmonton's own data, or you can contact Analytics, which was Dimer, and they can provide you the data that you want. And thank you so much for your time.